Hello, everyone. Welcome to the GE Health Cloud Innovation Challenge webinar. We're going to start in a couple of minutes, so please hold on. Thank you. All right. Hello, everyone. My name is Anil Patel. I'm from Devpost, and I'm here to talk about the GE Health Cloud Innovation Challenge. We also have Vishrut, who is from GE. So I'm going to start off just going through the basics of the actual challenge. So the first thing is just how to go through the whole registration and submission process. So you can register or submit your healthcare app at gehealthcloud.devpost.com. The deadline is the 28th of February next year, so you do have some time to submit from now until then. This is very important. Participation is only open to citizens or residents of the US. You have to be a resident during submission, or your company has to be domiciled here in the US during the submission period. The basic requirements for this competition is to submit a cloud-based healthcare software or application into one of three categories. That's clinical, financial, or operational. GE have got some great prizes for this challenge. They've got a total of $50,000 US in cash prizes, plus the opportunity to visit their headquarters in San Ramon. Also tickets to the Centricity Live conference in 2017 in Boston, and also an opportunity to meet with members of the GE Ventures group, so you can talk about your application to them. So I'm going to hand it off now to Vishrut, who's going to go into more detail about the Health Cloud and what sort of applications they're looking for and why GE is actually hosting this competition. So Vishrut, I'm going to hand it over to you.
Okay, thank you, Anil. Thank you, everyone, for joining this webinar. My name is Vishrut Parikh. I'm the director of GE Health Cloud Marketing Team, and I'll take you through some of the things about GE Health Cloud, why we are doing this, and so on and so forth. First and foremost, we are very excited about this challenge because as it's open for less than a month, yet we have 130 people registered for this challenge. So we are very excited about that. As you can see, there's a lot of excitement, enthusiasm around that. I have been also getting some questions via emails and from my personal contacts as well, that they are also looking to participate in this innovation challenge. We still have 82 days left. It seems like a long time, but we encourage you to go ahead and register. And most importantly, not just register, but submit your application as soon as you can, because we will start looking at the application as they come in. So please go ahead and register and then submit your application. When you submit your application, what are the chances, or why would you do that? Because we will be, GE Health Cloud is a platform that enables you to put your application on a healthcare specific platform, cloud platform, and allows you to submit applications that are geared towards healthcare providers and customers. And as you know, that you will have an opportunity to become one of the first partners with GE Health Cloud team to take your application to the GE customers and give you an amazing opportunity to build out your business. Can you go to the next slide, please? So just I want to give you a very quick overview of what GE Health Cloud is. So GE Health Cloud is a cloud platform purpose-built for healthcare. And what our vision for Health Cloud is to allow is a platform, like I mentioned. So, and then we also want to have an application ecosystem built on this platform. So our vision is to have GE Healthcare developing application on this platform for healthcare customers. And most importantly, the reason why we are holding this innovation challenge and this webinar is to have third-party software vendors, ISVs, to come and build and host their application onto GE Health Cloud as well. So in the end result would be a one-stop shop for healthcare providers and hospitals and physicians and clinicians to go for anything that they need for healthcare as far as the cloud applications are concerned. That's our vision. In addition to that, GE has been a leader in the healthcare business for a long, long time. So we have a large footprint out in the world. We have more than 500,000 imaging devices out in the world used by hospitals, clinicians in a clinical office, and so on and so forth. Our vision is to connect these devices. Our vision is to connect the hospitals to this platform and get the data into our Health Cloud platform. With, as you all know, as you're working on your leading edge application, without data, the applications are no good. So our vision is to get those devices connected to the Health Cloud platform and have the data available. Now, not only limited to GE machines and equipment out there, devices out there, our grand vision is to connect any device, any medical device that's out there to this platform, because platform is agnostic to devices manufacturer, who manufacture the devices. So that's our vision. Have the data come in, because we have a large footprint, provide a secure platform purpose-built for healthcare. GE develops applications, and we just launched 4 applications at RSNA just last week. Those are the first set of applications that GE developed. And the next phase, we are looking for ISVs like yourselves to come and host your application, cloud-based application, onto our platform. Next slide, please. Anil, you're going to talk about this?
Yes, we should. Thank you so much for that. I'm going to just talk a little bit about how to submit your application and what the requirements are for your application. So first of all, you do need to make sure that you're registered on gehealthcloud.devpost.com before you submit your application. Now, you can start submitting at any time. You can submit now, but you can carry on updating or editing your submission as many times as you want to until the deadline. So the deadline is the 28th of February. So I would suggest you submit now, and then you can carry on updating or editing your submission up until the 28th. You can also review the whole submission process. There is a tutorial that we have on DevPost. It's at devpost.com/software/submission instructions. You do need to create a video of your demo, a video of your demo. We suggest you do that at around 5 minutes. And again, that's something that you do need to submit and have ready for the 28th of February as well. We also suggest that you summarize your company's impact on healthcare outcomes. Now, you might have supporting data in the form of case studies or user testing results. We suggest that you put that together, and you can submit that also through the normal submission process. We say a maximum of 5 pages in total for that. You do need to make sure all your text and all your submission text is in English. And you do have to have at least 1 screenshot of your application as well during the submission process. You also need to provide us a way of testing your submission so that we can actually test that your application does what it says it does on the video and in all your documentation as well. As I said earlier, we suggest that you do submit as early as possible, as you do have until the 28th to keep on updating and editing your submission. As soon as submissions come in, we're able to review them and we can let you know if there's any missing information or documentation, or if there's any issues that you have with your video, etc. So the sooner you're able to get in your submission, the sooner we're able to tell you if there's any issues, and then we can let you know, and you can hopefully fix those. Please do allow us at least a few hours before the deadline to make sure that, if you are submitting, please at the last minute, do submit at least a few hours before, because that gives us that time to review and let you know if you do need to make any changes before the 5 p.m. deadline. After 5 p.m., we cannot allow you to make any more changes. So we do need to make sure that you're submitting before, that we can review and let you know of any issues before the deadline. Okay, Vishu, do you have anything to add to the whole submission process or anything else right now?
No, I don't have anything to add to the submission process, but it would be best because we have described all these steps that we talked about today on our gehealthcloud.devpost.com website. So I would strongly encourage you to go there, take a look at it. And if you have any questions, you can definitely follow up with us later on for sure. Yeah.
Correct. I mean, there's a few ways that people can ask questions. There is support@devpost.com. There is a River channel that we've set up as well where we can interact. And there's also a discussion forum, again, on the gehealthcloud.devpost.com site, where you can ask questions and interact with other members who have registered for this competition. Also, just a reminder that all timings for this competition, including the deadline, are on Eastern time. So I think what we can do is actually open it up for some questions to see if any questions have come in. So let me just have a quick look. We do have a question that's come in. Do we have to include supporting data to show our company's impact on healthcare? Vishu, did you want to take this?
Sure. We definitely encourage you to do that, because that would set you apart from the applications that are, because we expect a lot of submissions here. How do you set yourself apart is by showing us if you have any case study. Now, we do understand that maybe some of you have just launched a new application, so you may not have the case studies. So we do definitely want you to submit it. But if you have any data like that, it would definitely help your case for this innovation challenge.
Okay, thank you. Let's just see if any other questions are coming in. I think one of the key things that people are going to be asking around is on eligibility. So in terms of if a person is based in, let's say, Europe, based in the UK, but they have their app is built for the US market, does that make them eligible or not?
As long as the submission is done by the U.S. office, it has to be in the U.S. You cannot submit your application if you're outside of the U.S. Even though it's marketable in U.S., your company has to be in U.S. and a submission must be done from the U.S. personnel.
Okay, and I think that we've made that clear in the rules as well. So if you do have, let's say you have a team of people that are based here in the US, and you might have another member in England, and their app is based here in the US, then the team here can submit as long as that team that's submitting is the one that's based here in the US. Is that correct?
That is correct, yes.
Right. I'm not seeing any other questions coming in. Oh, here we go. Do I need to make changes to my existing cloud-based healthcare app to submit? So as far as I understand, you do not. You can, if you have an existing cloud-based healthcare app that's ready to go, already out there in the market, you can submit today. If you wanted to make changes to that and submit again, that's absolutely fine as well. Vishnu?
Yeah, I would definitely, well, the whole purpose of this Innovation Challenge is that we want you to submit your existing application. That's exactly the purpose. So yes, you do not need to develop anything new for this challenge. If you choose to do so, that's your prerogative, but that's not the requirement for the submission for this challenge. We want you to submit your existing application as long as it's a cloud-based application and meets all the other criteria that we just talked about earlier. But apart from that, we do not expect you to develop a brand new application for this challenge.
Okay, cool. Richard, in terms of what type of applications people are looking for, can this be any type of healthcare application, or do people have to really sort of, because there's three different categories that you have, clinical, financial, and operational. Do you think any healthcare app would be able to fit into one of those categories?
We think so, because those are pretty broad categories that we have purposefully decided to allow the submissions for. So we feel that it could, if your application is targeted for healthcare personnel or healthcare customers, we think that it would fit into any of those three categories. Absolutely.
Okay, brilliant. All right. Are there any other questions out there? Please go ahead and put your questions on the side panel to the video.
Well, one other thing that I want to add, Anil, if there are no other questions, is that yes, in addition to the prizes that Anil summarized in the beginning of the call, cash prizes, paid visit to San Ramon, California, where GE Digital headquarters is, and then one of the things that I definitely want to highlight is that Centricity Live is GE Healthcare Digital's user conference. So I want you to, for the winners, will have a chance to showcase their application and meet with GE Healthcare Digital's customers directly. That's a user conference that is going to be in Boston in May. You will get a free registration to attend that conference for the winners, and you will be interacting and showcasing your application directly to the end customer of GE Healthcare Digital. So that's an amazing opportunity for you to showcase your application right there in front of our customers, basically. So we strongly encourage you to submit your application as soon as you can.
Yeah, I think that's a huge benefit, Richard. Because GE has a massive customer base as well, and so being able to showcase that, especially at a premier event like Centricity, is, like you said, a huge opportunity. So, Richard, I think that's it. We're not getting any more questions coming in. If anyone does have any questions around the competition or on this webinar, please go ahead and email us at support@devpost.com, or you can go to the website, gehealthcare.devpost.com, and ask a question on the forum or on our River channel. And we will get back to you as soon as we can with our answers. All right, well, I am going to say goodbye from here at DevPost, and Vishnu.
Thank you very much for joining, and we look forward to your submissions.
Yes, absolutely. Okay, thanks everyone.
Bye.